Senator from Wyoming, I get home every weekend, talk to people, was home this weekend and for Veterans Day, and was in the Target store in Casper, ran into a small business owner, has a small electrics company that he runs. He has about 4 people that work with him, and he's somebody I've operated on. He's a former patient of mine, and he told me that he was one of those 4 million Americans who had gotten that letter that he had lost his insurance. He said, you know, the president promised that this would be easier to use than Amazon.com. I said, I can't get on. He said, it'd be cheaper than your cell phone bill. He said, well, that's not been the case. And he said, the president said, if you like what you have, you can keep it. Clearly not the case. He said, what's wrong? What's wrong with this? How can we fix it? I got another letter from a rancher I need to read to you, Mr. President, from Newcastle, Wyoming. She says, we're ranchers. We're ranchers who buy our own health insurance. Currently, we pay $650 a month for an 80-20 policy with a $3,500 deductible. She says our maximum family out-of-pocket is $10,000 a year. We don't carry maternity insurance, she said, because we've completed our family. She said, I'm 45 years old, and she said, I've had a hysterectomy. So she said, I recently called my insurance agent out of fear our policy would be canceled. Well, he said it would be canceled at the renewal time. She says that he told me that their policy didn't meet Obama's requirement because of maternity coverage, and they'd have to choose a policy from the exchanges. Now remember, she's had a hysterectomy. She doesn't need or want or ever going to use maternity coverage. She said that the insurance agents quoted her rates for a comparable policy at $1,300 to $1,600 per month. Remember, they're now paying $650. He said the insurance agent also told me that they could take a bronze policy, much less coverage than they currently have, for $900, still $250 a month higher than they'd have to pay. But the out-of-pocket cost then was much higher, much more difficult for the family. He said, we're being forced out of a good policy, which we pay for with hard-earned money, and which we choose, she says, into a dangerous financial and health care situation with less coverage, and which puts my husband and I, who are proud of our sustainability, onto what we consider the welfare rolls by needing a government subsidy to afford a plan that we don't want or need. She said, to say that we are angry is an understatement. Why is this happening? Why can Obama force me into this? We feel helpless. So what are we supposed to do? Just follow like sheep until we're either bankrupt or welfare recipients? Mr. President, this is not what the President of the United States promised the American people. It's not what every Democrat in this body who voted for this health care law promised the American people. The American people deserve better. They deserve to be able to get the care that they need from a doctor that they choose at lower costs. None of that has come true under this health care law. Thank you, Mr. President. I yield the floor.